Oh, we have an ad at 10. I should just take it. I should take it then. Yeah, we're supposed to go in, but we have an ad.
I can barely hear anything.
No, it's fine. But you can hear
The
what's going. Yeah,
music,
yeah.
yeah.
All right,
So
that's
that's
that's.
what's on air now.
Yes, that's what's on air. So we'll come in after the music. Oh,
Okay.
sorry, we have an ad after the music, so we're
Okay.
coming after that.
Okay, let me make sure my phone is on silent.
For those who want to make the right choices every day, choices that bring out the sparkle in you, and those that are inspired by you. The new Nestle Pure Life Sparkling Water is made just for you. So go ahead and get your sparkle on with the new Nestle Pure Life Sparkling Water.
Love music, love life. That's where you are. This is Smooth 98.1, and this is Breakfast in Bed. If you are wondering where you are right now, it's the Soul Food Conversation. And if you're not a newbie to this segment, you know that it's all about your health and your wellness. And on days like this, where we have an international observance, where we bring awareness to the topic of, to the subject matter. This morning, we are talking about your oral care, your dental health, because it affects your overall well being. Tomorrow, being 20th of March, happens to be the World Oral Health Day, and the theme this year is Be Proud of Your Mouth for Your Happiness and Well Being. Now, to do justice to that topic, I am not going to be the one doing all the talking. So, I have a special guest who is very much qualified in the field. Well, we call her the Smile Doctor. She's beautiful, she's radiant, she gives you your smile, she gives your teeth back in good condition. If you give her 20, she'll give you 32. And of course, she is a seasoned dentist. I am referring to the founder of Lux Dental Care. Also, she is the chief executive officer in the Smile department. Her name is Dr. Olufumilayo Adeniyi. Good morning.
Good morning,
Oh,
Cheryl.
that voice is so lovely, so
Thank
sweet.
you.
How are you doing this morning?
Very well, thank you.
All right, it's good to have you in the studio, especially everybody that joins me in the studio, I always give them a special vote of thanks
Mm,
because it's not easy to get out of the bed
I
on a
know.
Saturday morning, especially when you've been working all
All
through
week.
the week. So thank you again.
Thank you.
Now we're talking about the World Oral Health Day, and we're talking about being proud of your mouth for
Mm,
your happiness and well-being. Now, taking care of your teeth just looks like it's a normal thing. I don't even need to take care of my teeth. How does my teeth affect my overall well-being? So
mm,
first off, let's start with that. What does it entail? How do you mean, okay, if I don't take care of my teeth, it could impact on my general quality of life?
Okay, I'd like to say that your smile is one of the first things that people notice about you when they meet you. There's been a lot of research carried out. People invest in hair, in makeup, in their skin, and then they leave out their smile. And your smile is actually the first thing people remember about you when they meet you. Beyond that, your mouth houses your teeth that supports your smile, that supports your face, and then a lot of blood vessels are connected to this mouth. Your mouth mirrors everything happening in your body. So many times when you have a disease condition, your dentist might be the first to spot it because we can see a lot of systemic conditions by what we see in your mouth. And so your mouth is critical. You use your mouth to speak, to eat, to laugh, to kiss. So your mouth is like so important in the scheme of things, and so we cannot neglect our oral health. There's a we I like to say that there's a pandemic of oral diseases presently because
Ooh.
oh yes, because almost 3.5 billion, if that's not the number from WHO, says people are affected by oral diseases, and so there has never been a better time to shine the light on oral health and maintaining oral health than now.
Oh, thank you so much. Now you have heard that how it impacts and affects your overall well-being.
Mm.
There is a pandemic. We have already a pandemic going on, so please do not add to it. Remove yourself from that number
Yes.
and help yourself.
Mm.
And I always ask, when last did you willingly visit a dentist? That it was not
Dentist.
something; it was a pain. And you know
Mm.
how crazy the pain of toothache can be.
It's worse. It's almost as bad as the pain of labor. almost as bad.
Yeah, worse than the physical pain of heartbreak.
Mm. Yes, absolutely.
All right, that being said, you know that you can be a part of this conversation. Yes, what you can do is send your WhatsApp message to 0809 444 0981. Again, 0809 444 0981. But you can call on the number 01448 9981. You're allowed to quickly use the services, the free services of my guests. Now, be guided in how you want to use that services. Just one or two questions, that's okay.
Mm.
Not that you're going to gather everybody and be asking the question you should ask in the clinic.
Yeah.
No, please. Just your question, something you want to clarify. Now, that being said, as we have laid the foundation and the background for it, let's talk about gum disease.
Mm.
That's periodontitis.
Periodontitis.
I tried now.
Periodontitis.
Now, what is gum disease? Now, first off, I ask that because sometimes we have that swelling, that temporary swelling in our mouth, and somebody says, "Oh, go and use saline or salt
Mm,
water
mm,
in warm and all of
mm.
that." So, first off, gum disease, what is it?
Okay, gum disease is an infection of the gums and all the supporting structures that hold your teeth in place. And so a lot of people confuse gingivitis for periodontitis. So gingivitis is simply the swelling of your gums, and then it's red, it's inflamed. When you brush, you bleed and all. But that can be reversed with the simple procedure of scaling and polishing done by your dentist alone. However, periodontitis goes beyond just the swelling of the gums to affecting your supporting structures that hold your teeth to your gum. And so then you experience a lot of bad breath. You experience mobility of your teeth, where your teeth begin to shake eventually because the foundation is broken, is destroyed, and really that's what it is. So it destroys the bone that supports your teeth and causes your teeth to loosen, and eventually to eventually lose the tooth if you do not visit a dentist.
Oof. Now, begs the obvious question, what are the causes of gum disease? Because you already said that gingivitis,
Yeah.
which what I thought first was ginger, uh, is not the same as periodontitis, right? So, what causes periodontitis, which is gum disease?
Okay. The first port of call is plaque. That's like a thin film of bacteria that rests on your teeth. And almost every day when you wake up, you can find plaque on your teeth. When you take sugary things, you find plaque on your teeth. And so that's why we emphasize brushing twice a day to dislodge that film of bacteria. So when plaque forms, it hardens over time when your saliva supplies calcium to it, and then it becomes calculus. So that's that thick yellowish whitish thing you see on your tooth that cannot be displaced by your toothbrush no matter how hard you brush. And the mildest form of gum disease, as I said before, can be reversed, but once it advances to periodontitis, you need to be seeing your dentist. Also, poor oral health habits can be risk factors for periodontitis. Hormonal changes, smoking of tobacco. So even shisha has even been found to be more
More,
dangerous
yes.
than the regular cigarettes and tobacco. Recreational drugs like marijuana and all that. Obesity is seen as a risk factor.
No,
Poor
pause.
nutrition.
What?
Yes,
Obesity?
because there's usually just the high amount of sugar and all that is just affected. It's still in the works of being researched, but they found a very high connection with obesity and periodontitis. Some medication that cause dry mouth have also been implicated. Once medications affecting salivation and causing your mouth to be dry, there's a high propensity of developing periodontitis. A lot of diseases that also reduce immunity, like HIV, um, cancer, all those diseases, diabetes, rheumatoid arthritis, and all that. Yes,
Rheumatoid arthritis.
yes.
How is something that is affecting your bone affecting your gum?
It's the same thing that holds your bones. It's the same substructure that holds your bones in place that translates there in the mouth. So it's your body is largely interconnected.
I see.
Yes.
That is interesting. Wow. You know, when you first mentioned obesity, yes, I know I'm on serious, but then I felt like, okay, is it that the gum gain weight too?
No. It's just all the attendant factors of lowered immunity, high sugar, high blood glucose, and all that translates eventually.
Hmm. So if you belong to the class of people who want to do allow me, let me enjoy myself, and you're eating everything, now you know that everything is interconnected. So
Yeah.
do not do yourself a disservice by overindulging. When you're done eating all those sugary and sweet stuff, yes, it's okay for you to enjoy the life of your head, but clean your teeth afterwards, brush properly, and also floss. Now let's go over to something that you mentioned while you were talking about the differences between gingivitis and gum disease. Is it possible that an inflamed gum should could be a symptom of
That's
periodontitis?
the first sign. That's the first marker, yes. But it can be reversed at that stage. And so that's why we always say visit a dentist every 6 months, because your dentist can nip a lot of things in the bud at that stage.
Okay, so what are the other symptoms of gum disease?
Swollen, puffy gums, red, red looking, inflamed gums, gums that are tender to touch. You touch it and you feel pain. That's not normal. Gums that bleed easily. You're chewing an apple, you begin to see blood. You're brushing, you're bleeding. You're eating something tough, you see blood. Pink, once your toothbrush is stained with blood, also that's a sign. Spitting out blood when you brush and floss. Bad breath, when you begin to see pus in
Ew.
between your teeth and your gums, just know that there's something that's not normal. There's absolutely nothing normal about that. Loose teeth and mobile teeth that you just feel like, oh, my teeth are shaking. That's not normal. Your teeth are not built to
To be
shake. No,
mobile.
they're not. When you feel pain on chewing, and so that's how you why you have to see your dentist, because pain on chewing can also be caused by basic cavities, and so seeing a dentist would help to solve that issue. Once you notice your teeth are drifting also over time, your teeth didn't used to be this far apart, now they're so far apart, you're growing a huge diastema where none was, visit a dentist. Gums that recede, you notice that your smile line is changing, you're seeing more of the roots of your teeth, then there's something really wrong
I
going
am
on there.
curious about the diastema. How do you have a diastema where you didn't have one before?
Oh, I like to see that our teeth are constantly moving, even without having a disease. I believe that our teeth are largely in motion because we're alive, and all. And so many times when a person you extract a tooth, you notice that teeth begin to drift into that space because nature abhors vacuum. And
Oh.
so, but when it is beyond normal, like I noticed that, oh, when I got married, my space here wasn't this large. Now it's slightly larger. That's been almost a decade, and so it's still within range. But when you notice last year there wasn't this huge space there, now there's a huge space your tongue can pass through, a fork can go through, then there's a huge problem there.
Is it the same reason why we have people who, and now I'll use myself as an instance. When I was little, my diastema was way wider than this. And gradually it was like it was closing up.
Okay, that might have been because all your teeth weren't in line yet.
You
Yeah.
don't have to say it now. Yes, I know.
That's what I'm saying, that that's not a disease condition, that's like a structural adjustment thing.
Yeah.
Like, so the more they come in, everything is falling into place, so that's not the same as.
Well, I agree. Everything was not properly
Yeah.
arranged. In fact, I had double teeth at some point, and somebody used to call me Tiger, and it was unfair. But I have come to terms with it. I still have small, so I'm good. I have this one from Rex from Festac saying, please, my boss at the office has a very bad breath. And it's really making me uncomfortable. How do I tell him and still have my job? Rex! Doctor, do you have any advice?
Recommend a dental service for the whole office. Don't isolate it. Say, sir, I was on a radio show this morning and I heard just tip it and just drop a few hints, and you can get him a voucher to a dental clinic. I think that's the safest way. It's World Bosses Day. Just coin something and give him a voucher to a dentist.
Wow, Rex, that is a very bold move. You're very kind, you're thoughtful, but this is a bad time, an economically bad time to lose your job
Right.
because you are now I understand that bad breath, whew, it can be seriously life threatening. You have some people talk to you now in your face and it's like, no, you take my breath away. Not in a good way. But Rex, you heard the recommendation. You can just say, okay, boss, I think maybe part of our HMO there is. I
Yeah,
have
yeah.
some clinics that I could recommend to join our HMO and all of that. Or you say, okay, you know what? Let us go on a dental retreat. Well, it's quite interesting. But
Yeah.
how do you generally? How do you advise people? Um, give suggestions on how to deal with bad breath. I mean, to tell others to deal with bad breath.
Or routinely, we raise it up because it's a huge problem that a lot of people suffer from, and nobody wants to talk about it. So
Mm.
routinely, once you visit the dentist, we're talking to you about brushing your teeth, about flossing, about focusing on your tongue, about visiting a dentist. And the truth is, bad breath is not just caused by all this. If you
Yeah.
have a hole in your tooth, that's a huge cesspool for bacteria and
Mm.
all sorts. If you have periodontitis, that's a huge one. If you have underlying medical conditions, diabetes,
Mm.
liver, kidney issues, it would manifest in your breath also. And so, if you're big on garlic, high sulfur containing food, it would manifest as bad breath also. And then we have the physiologic causes where just early in the morning, the normal, I haven't had breakfast, my mouth is dry. When you're fasting, that's a physiologic cause that can be reversed once you eat, once you have water. And so we always bring it up during routine consultations with clients and just dispel it. And once you come on the dental chair, you open your mouth to us. So if there's anything happening there, we're the first people to smell it, and we're professionals, so you won't see it as me attacking your personality.
Yeah.
You see it as me giving you help.
Okay. I have another suggestion for you, Rex. You can just decide to package a small hamper and give it to your boss. But in that hamper, make sure that the biggest size of toothpaste and toothbrush is there. Maybe he will get the message.
But in the end, we always say that your toothbrush is not enough.
And just the
So
signal that.
something is happening here.
All right, we're not done with this conversation. Stay with us because after this, we will come back to wrap it up here on Soul Food. We're talking about your oral care, your dental health, because tomorrow is World Oral Health Day, and I have my guest, Dr. Funmi Adeniyi. This is Smooth 98.1.
Love life.
You can't lose your job because because of bad breath. Be wise.
Convenience, lifestyle goals, or just simply getting service that is designed just for you. Yeah, we thought you might like all of that and more. That is why we specially created Providus Bank for you to take care of your daily experiences. At Providus Bank, we believe that banking should be all about you and your business and how to get you to the next level. If you do not already have a Providus Bank account, please speak with our business concierge on 0700 77 684 387 or email businessconcierge at providusbank.com to switch to a future forward banking experience. Providus Bank. Future forward banking.
Talent for Uberekete for our Nigerian youth and then sabi new technology with better ideas. Only be say some of them not they put mind for what our leaders them they do. Even when they para and march for road, make things for
Do you
better.
have a health background?
You said?
Do you have a health background?
A.
Health background.
Yes, I do.
And what?
Nutrition.
Okay. Where did you study that?
Where did I study it? OAU.
Okay.
Obasanjo University. I studied nutrition and dietetics.
Okay. Are you doing anything with that now?
Well, this is the closest that I actually still sometimes, if it requires me offering my knowledge or being a part of a team or something like that, yeah, I do, but not full time. I decided not to go ahead with it because the hospital clinical practice is not for me. So I switched over to health communication instead. I will come back in. A lot of things can feel good, but definitely not a painful gum and certainly not a bad breath, especially when it is in your face. That's what we're talking about this. If you are just joining the conversation, you're just tuning in and you're wondering what's going on, you have missed out so much, oh, so much. But do not worry, you can go to YouTube and search for Smooth 92 FM Lagos. The video will be up there for you. We're streaming live right now, so you can be a part of the conversation. But I have just 2 more minutes. So if you have your question, send it to WhatsApp 0809 444 That's the WhatsApp line. But if you have a question that you want to call in to ask, Quickly, I have the space for just one more call. 01448 is the number to dial. 01448 is the number to dial. Well, I do have my guest. She is the founder of Lux Dental Clinic. Of course, she's a smile doctor. She's Dr. Funmi Adeniyi, and she's a seasoned dentist. We're talking about World Oral Health Day. Be proud of your mouth for your happiness and well-being. Okay, I'll take this call. Hello, good morning. Good morning, sir. Your name and location. Thank you for calling. What do you have to say?
They would usually need to see a dentist to help with that because there are many factors that come into play. There are many things that might be causing that hypersalivation, or just something that has to do with them actually swallowing the saliva they produce. And usually, so it's best to just refer them to a professional to help them with that. But there's no home remedy to reducing that. There's no DIY quick fix to that, and usually to dental processes. So it's best to get them to a professional.
All right. Thank you for calling. And that's it. That's all the call and messages I can take because we are out of time. Time flies by when you're having great information being dished out to you. So thank you to everybody who's been a part of the show. Now, what will be your general recommendation, tips, advice, and did we touch on the treatment for gum disease? I think you were just dropping it.
Slightly.
Yeah. Well, yes. Okay. So general recommendation, advice, and how somebody can deal with gum disease.
Okay, basically brush twice a day, floss regularly, visit your dentist every 6 months. If you're on a HMO and it's been deducted from your salary, please visit your dentist. The thing is, prevention is cheaper than cure. Neglect is expensive in dentistry. So the longer you stay away from the dentist, the more your bills pile up when you get there eventually. So invest in visiting a dentist every 6 months. Water, drink a lot of water, pay attention to your general health also, so that there's no underlying condition that is predisposing you to all this. And so I think all these really cover, it's good healthy fibrous food, make sure you're getting the best of nutrition in, and hopefully.
Thank you. Thank you very much. Prevention is better, less expensive than cure. And of course, we always say what you don't know will not kill you. Trust me, when it concerns your health, it will kill you. It will hamper you and, of course, impact on the quality of your healthcare. But I have a quick fix for you. One of the reasons you can, or how you can get to visit the dentist more is you can just choose a very fine looking doctor so that you are eager, you just want to go and see them, especially when they are nice and very accommodating and warm like Dr. Fumi. So just choose a good dentist so that you are looking forward to every of your dental appointments. So you can follow Dr. Fumi across all social media platforms. On Instagram it is Fumi_Adeniyi. You can also follow Lux Dental Clinic and Smile Dr. NG. Go there, you see it will draw you in, and then you'll be inclined towards making that next dental appointment because overall it impacts on your health. So thank you so much for being a part of the show.
Thank you very much for having me on.
It's a pleasure. And everybody who's missed out on this one, I will save it up on our WhatsApp status for you. I'll just put the link up there so that you can share it with somebody. And if you have somebody who has a dental condition like halitosis, which is bad breath, you can just share the link to them and say, "Oh, I heard something on radio today. I think you should be aware of it." They'll get the gist. Oh, okay, I just said it. Anyways, you get it. Now we are not done. 8:40 is for the kids, and I'm looking forward to it. It's the game show for the kids between 6 to 15 years of age. Always, it's a great time. So, parent, time to hand over the phone to your kids. This is Smooth 98.1. Thank you, thank you, thank you.
Thank you very much. How many shows do you anchor?
Okay, so this is the only show.
Okay.
It's a 3-hour show.
Wow.
Yeah. So 7 to